There are numerous new and emerging topics in healthcare that are area of concern to the field of public health, and antibiotic resistance is one of them. So we're going to be discussing what antibiotic resistance is, what's causing it, and are we losing the fight against it? So what is antibiotic resistant? Basically, it's when antibiotics no longer have any effect on the bacteria. And this happens because bacteria can change and adapt to the antibiotics and eventually rendering them ineffective. And this allows for simple infections that used to be treated easily with antibiotics to become more serious and possibly even deadly. And this is happening all the time. The new organisms are only continuing to emerge. So how do bacteria acquire resistance? Well, from the beginning, bacteria have shown characteristics of resistance through intrinsic and acquired means, and there are several ways that they can become resistant. Some can actually neutralize the antibiotic, essentially making it ineffective. Some bacteria are actually able to pump the antibiotic out of their cell wall before the antibiotic can kill it. Others mutate in such a way that the antibiotic can no longer attach to them. And in some cases, the resistant bacteria are actually able to pass the resistance on to other bacteria. So each time someone takes an antibiotic, most of the bacteria are killed, however, resistant bacteria remain. And even if it's only one single resistant bacterium that remains, then they're able to multiply and spread their resistance. So some of the resistant bacteria that are causing the most alarm are MRSA, CRE, VRE, and Clostridium difficile. And it's important to note that carbapenem and vancomycin are extremely strong antibiotics that are many times used as last resort to fight some infections. And as you can see, CRE is a great concern as some have become resistant to all or nearly all available antibiotics. There's not just one factor contributing to resistance, which is part of why fighting it is so difficult. But in general, the overuse and misuse of antibiotics is the biggest cause. This happens on the side of the healthcare providers and the general public. For the general public, one factor is that they request antibiotics for illnesses that are not caused by bacteria. Antibiotics do not kill viruses, which means they don't cure a cold, the flu, a sore throat, and a lot of times a sinus infection or bronchitis. Patients that go to other countries and get antibiotics over the counter are a huge concern because many times they're taking them for the wrong thing. And saving or sharing antibiotics is something that is done very regularly. People don't finish their course of antibiotics because they either want to save them for the next time they're ill, or they start to feel better after a few days, so they stop taking them. And many people share their antibiotics with their friends. One study found that 25% of patients did not finish the full course of antibiotics prescribed to them. Lastly, many times people dispose of unused or expired medications down the drain or toilet, which allows them to enter our water and soil. So what are the factors contributing to resistance on the side of the healthcare provider? They stem from many different areas as well. A lot of times physicians feel pressured to prescribe antibiotics when patients ask for them. So the doctors give them because they want to protect the doctor-patient relationship and they don't want to upset the patient. They also want to avoid more serious infections, and they fear malpractice if a more serious infection should occur. When antibiotics are needed, many times they fail to prescribe the correct one or the correct dosage. They do not routinely perform culture and sensitivity tests, especially in outpatient settings, which would provide us exactly what bacteria the patient has and which antibiotic to select for treatment. The pharma industry also plays a role. However, it's hard to estimate how big of a role they play, as many of the industry deny any connection between antibiotics given to their animals, which become our food supply, and the increase in resistance. There are also many reports that while industry leaders say they're willing to help scientists in any way they can, when it comes down to it, access to their animals is limited. So there's just a lot we don't know. We do know that approximately 21 million pounds of antibiotics were sold to farms in 2014. And in one Iowa farm, 70% of pigs tested were positive for MRSA, which is believed to be able to be spread not only to other animals, but also to humans. So the biggest question really is what can be done. Well, there's several things. First is antibiotic stewardship programs. These need to be implemented in all healthcare settings worldwide. It's estimated that 30% of antibiotics given in outpatient facilities are not needed. Physicians also need to be performing culture and sensitivity tests, which allow them to move from broad to narrow spectrum antibiotics. And educational campaigns are important for the healthcare provider and the general public. It's vital that people understand that not all infections or illnesses require antibiotics, and patients need to understand that they must finish the full course prescribed and should never share their prescriptions. And they also shouldn't be pressuring their physician for antibiotics. As consumers, we need to seek out antibiotic-free meat. The CDC has been an active participant in the fight against resistance. They've established 4 core actions, which include preventing infections and their spread, tracking patterns of resistance, antibiotic stewardship, and developing new antibiotics and diagnostic tests. They stress that prevention is key in managing these infections and that hand hygiene, washing your hands with soap and water or an alcohol sanitizer, is essential to controlling their spread. It's also important that we look towards the future and to alternatives. More research needs to be done in the areas of probiotics, immune modulation, antibodies, vaccines, antimicrobial peptides, and liposomes. Understanding antibiotic resistance is important for many reasons, one of which is the impact it has on the health and wellness of our communities, as well as globally. Every year, 2 million people are infected with drug-resistant bacteria, causing 23,000 deaths per year. If CRE reaches the bloodstream, there's a 50% chance of mortality. But besides the physical toll of lives lost and extra days spent in the hospital, the emotional toll this brings to patients and families is devastating. And the financial toll is high also, with estimates reaching $20 billion annually to treat antibiotic-resistant organisms. Obviously, you can see from everything that's been presented that antibiotic resistance is a huge public health threat. The CDC has declared it that it is one of the world's most pressing public health problems, with implications at the individual, community, and global levels. With the increase in world travel, the resistant bacteria can spread quickly and easily across borders, making it a global threat. No country is immune, as it only takes one person that traveled abroad to bring resistant bacteria back to that country. Also, because access to antibiotics is still limited in some countries, the need to couple access with stewardship programs is essential to public health. So while this problem is not going to be solved overnight, scientists warn we are in a race against time to create an antibiotic that is invincible. The problem is that most likely will never exist. As an infection preventionist, I see the gravity of this situation on a daily basis. And I also see the nonchalant attitude that many people, even physicians, have towards it. It's important that physicians are prepared to tell a patient they don't need antibiotics, and it is also important that we as patients ask if they are necessary when they're prescribed to us. My boss has been in infection control for over 20 years. She has a PhD in microbiology, and her husband is a pathologist. Yet, when he had antibiotics prescribed to him by the dentist to take for 1 week before a minor dental surgery, not even he asked why it was necessary. He just took them. This problem isn't going to get any better unless we take a multidimensional approach that entails cooperation between many stakeholders, which include the public health officials, healthcare providers, pharmacists, and the general public. The healthcare industry can do everything in their power to control this, but if the public does not grasp the severity and join in the fight, we're not going to be able to win this deadly fight.